Most of the time people come to see me, come see our clinic when they've got a chronic condition. A lot of the times what will happen is that they may go to different therapists, they might have gone to an MD specialist, so on and so forth, and they have a hard time figuring out what the issue is. Basically, when they come in, I'm almost, in a way, the last resort because of the style of massage that I do, the type of therapy that I do. It's usually one of the last things people want is something painful and something that works deep, but it is very effective. Basically, you can come in without having a referral, whether it's from your MD or PT, but it's actually a good idea to bring one in so that we can see what exactly might be the problem. So although you don't need one, it's a good idea to have it on file so that we can look at you and connect with whatever therapist you're dealing with or your doctor. So this is another common question that I get asked in terms of dress. Now, if you've never been to a massage therapist, one of the things you have to understand is that you dress to a level that you're comfortable with. So that could be, you could be potentially like, wearing a sweater, wearing your pants, so on and so forth. But ideally, you'd want the therapist to actually work directly on the skin. Now, if you're very tentative about that, you might want to wear a t-shirt. You might want to keep whatever you want on and then slowly get more comfortable. As you slowly get more comfortable, start maybe wearing less clothing so that the therapist can actually access the tissues. Having said that, a lot of times I actually work with shorts and t-shirt, depending on what the condition the person might have. Okay, so the 1 hour appointment for the first appointment is necessary, and the reason why it's necessary, I always get asked, is why do I have to come in for an hour? Can I come in for 30 minutes or 45 minutes? I actually work differently from generally massage therapists. A lot of times you come in, go into the room, get undressed, and you just jump on the table. For myself, I think it's essential to figure out what is actually going on with the person. So within the hour time frame, I take about 10-15 minutes, depending on how complicated the issue is. So I can perform the proper treatment as opposed to sort of just jumping on the table, and if you've got back pain, just working on the back. Because essentially what can happen is that it could be that you're feeling back pain, but it could be stemming from something else. And through our discussion, I can figure out what potentially is happening with you. It's also a good time for me to educate. I use my charts to help show you what could be potentially happening with your condition. I always get asked this question too, like, what is my style of massage therapy? Now, in massage school, we're taught basic massage. All of us are taught like basic massage theory and basic massage techniques. As you progress, as you graduate and you start working in practice, you start developing your own style, your own technique. The way I describe my own style and technique is I work fairly deep, and the base of my work is based on connective tissue, working on the connective tissue, the fascia. And that's where I kind of jump from in terms of like how I treat the particular person. So this is a question that gets often asked before the treatment and actually during the treatment in terms of how many treatments should I get. Initially, it's a very difficult thing to answer. Like, it's not as straightforward as some people might think. The problem with that is that a person may have come to me and have had treatments for months on end or whatever it is, without a potential time frame where the treatments should potentially end or should get better, so on and so forth. So it confuses people. So to decrease the amount of confusion, what I believe is fair is I tell the patient it's necessary to come in for the first for 4 treatments in a row. And the reason why I say 4 is because I think 4 is a very good number to judge whether you feel you're getting better, whether there's improvement in pain and how tight the muscle is, so on and so forth. And what I tell patients is that after the 4, we can decide together in terms of like whether you want to continue on based on what you're seeing in regards to whether you're getting better or whether you feel like there's something else necessary to get you better. So I think 4 is a very fair number. I don't want to keep you in like forever. Obviously, like the way I work is that I try to get you out as possible so that we can get you into more of a preventative maintenance mode where you come in maybe once a month just to make sure that the muscles stay nice and soft, as opposed to coming in weekly for the next 18 months or 18 weeks or whatever. But anyways, that's usually the game plan with most. So this is another common question that I get asked is that, like what percentage of males or females do I see? And the answer is about a 60-40 split. 60% that come in are mostly female that come into the clinic, 40% males. Now my theory behind this is that I believe that females tend to be more open to complementary therapies. They tend to, when there's an issue at hand, they want to get it treated potentially as quick as possible, as opposed to the male kind of mentality where they may wait until it becomes horrible for them, and then they eventually come in. The conversation I usually have with the females about their partners is that they try to get them in, they try to convince them that it works, but they're very stubborn. And usually what happens is the partner comes in when they actually feel like there's too much pain to handle. That's it. Finally, as you can see, I am wearing my colors, my Blue Jay colors. It is October 4th, it is 2016, and I'm cheering on our Blue Jays for the wild card game tonight at 8 o'clock against the Baltimore Orioles. Go Jays!